The next topic we have is making digital health solutions sustainable in healthcare systems. We have a practitioner's perspective by Dr. K. Madan Gopal, Senior Consultant at NITI Aayog, Government of India. Dr. Gopal is a healthcare professional with MBBS, MD qualifications, and started working on issues related to the healthcare systems reforms and strengthening in India for more than 28 years. Currently working as a senior consultant with the National Institution of Transforming India, Aayog, the apex policy think tank for the Government of India, and contributing to various healthcare initiatives, transformative programs, including Ayushman Bharat. We have Dr. Gopal next. Thank you.
Hello, good evening. Uh, First of all, I'm very much grateful to the Global Sustainability Development Summit for giving me this opportunity to share my thoughts and view about how making digital solutions sustainable in the healthcare system from a practitioner's perspective. As we have seen during the COVID times, had it not been the digital solutions, then the things would have been very, very different. To talk about when the pandemic started, we could not think what kind of solutions would be available. But now you see, during the COVID times, we have seen the start of the Aayog Setu, that's an electronic tool, wherein if a person is positive and the suspect is coming in contact with that person, immediately some containment and other measures could be taken. You see how the digital thermometers and the digital pulse oximeters, they have revolutionized the home-based care during the COVID times. These are some of the solutions. When the time challenges, these solutions come. It's not that simple that okay, we have arrived to this thing. One more interesting thing in the digital sphere which has happened during the COVID times was the crowdsourcing of the crowdsource initiatives for the digital development. You have seen that so many websites are there. They are using artificial intelligence, bots, and other mechanisms to pull in the data and see that how that data is translated into this. Having witnessed the earlier pandemic, this pandemic was different because a lot of data was available because of the use of digital solutions in the form of AI, bots, everything. We used to collect information, and immediately now whatever, if anything is happening in the media also, to the help of our AI bot, then you can immediately fetch that information, and that is available for use. Now I will try to highlight that the efforts towards the digital health, they started during the early part of this century, wherein the telemedicine was started as a on a pilot basis, which was subsequently rolled out as a program. Then during the early part of this decade, that means around 2010-11, we had tried with the enactment of the Clinical Establishment Act. We envisioned to have electronic health records, use of electronic health records for whole of the country, which simultaneously after all these efforts, now we have a national health policy which envisions to have a digital health technology ecosystem and recognizes the integral role of technology like e-health, mobile health, cloud, Internet of Things, wearables, etc. in the healthcare delivery practices, which we have witnessed during the COVID times. To roll out the digital health, we have created an institutional framework. We are having three institutions. One is Center for Health Informatics, which is located at National Institute of Health and Family Welfare, New Delhi. This was established in 2013 for managing the National Health Portal and the e-health initiatives of the ministry. We have a National Resource Center for Electronic Health Standards, which was established in 2014 and is located at CDAC. It was supposed to facilitate the adoption and promotion of EHR standards in healthcare IT applications. Then another institution which was created was National Resource Center for Telemedicine, which was established in 2011 at Lucknow to develop and strengthen telemedicine technologies in this. Though things were happening in the telemedicine field, But the legal and more power was given when these telemedicine guidelines were released during the COVID times. It has given a legal backing to the teleconsultation, telehealth, and as a result, you have seen a leapfrog into the telemedicine uh, platform in the country. These are the few digital initiatives which are happening in the health sector. One is the integrated health information platform. So this has been developed with the enablement of the GIS mapping to predict early outbreaks with the outbreaks and clustering of the cases. Then we have a national medical college network wherein all the government medical colleges are interconnected to allow teleconsultation, tele-education, remote learning, live surgery interaction. We have hospital information system, which is an integrated HMIS suite, which consists of health information system, PACS, blood bank, and telemedicine suite to help digitalize administration workflows of the hospital. We have a reproductive health portal, which usually track the care and support to the mother, children, and eligible couple for their reproductive and child services. We have Kilkari, our mobile service to deliver audio messages on pregnancy, childbirth, and childcare. We are having online registration system which facilitates online registration and appointment in public hospitals. We are having Mera Hospital with an IT-based patient feedback system to collect information on patient level of satisfaction. We are having e-Rakt Kosh, which having a blood bank system which connects all the blood banks so that a blood storage and that can be this. We are having TV monitoring system in the form of Nischay, which is a web-based application for monitoring this. But all the systems are working in silos. We require, these are the challenges in the subsequent slides when I will be making the presentation. You see that how these silos are being broken. As I mentioned in my previous slides, with the release of the telemedicine practice guidelines, it has opened a plethora of platforms for this. Even in the government sector, you are having a platform which is known as eSanjeevani platform. eSanjeevani is having two components. One is telemedicine in the health and wellness centers. If you look at the structure of the country in the health sector, we are having states. Each state is having the district or a county, and each county is having development blocks or this. In the development blocks, we are having the sector, and each sector is divided into sections. And corresponding to this, you are having a section headquarters in the form of health and wellness center. At the primary healthcare, you are having a primary healthcare center. At the block headquarters, you are having a community health center or the block health center. At the district hospital, at the district level, you are having district hospital, and we are envisaging to have medical colleges on most of the district hospitals. What we do, these telemedicine are happening right up to this level, that is health and wellness center, which essentially is at a population of 3,000 to 5,000 depending on the difficulty of the terrain. That means at that level where we are trying to push in the medical expertise to that level so that the person who is there, he can facilitate a doctor to doctor consultations. 11 states have been actively rolling out these teams. There are more than 70 plus doctors. Hubs have been created by the states which are linked with around more than 3,500 health and wellness centers. And remember, India being a very big country, we are having around 1.5 lakh health and wellness centers. And subsequently in the coming days, you will be connecting with all the health and wellness centers. What we do, apart from this, we are trying to provide OPD consultation for COVID management. Patient to doctor consultation is happening. We are allowing the registered medical practitioners to provide healthcare services to telemedicine. These are some of the initiatives by the Ayush, that is the alternative system of medicine. They are having an Ayush hospital management system, Ayush Suraksha, e-Charak mobile application, National Ayush morbidity and standardized terminologies, then e-Aushadhi, TKDL portal, Tikanda Kosh, Ayush research portal, e-Rakt Kosh. As I mentioned in my previous slide, in the health also, in the Ayush also, the things are fragmented, and I'm trying to bridge all this thing together in the form of Ayush Grid. Having witnessed this, it's now very clear that the digital landscape in the country is especially in the health, is highly fragmented. You are having ICT systems across the spectrum in the country. You are having beneficiary identification system. You are having payment systems. You are having human resource management system. You are having supply chain management system. You are having hospital management system. But the problem is no single view of beneficiaries can be seen. The data system is weak. The quality of data is poor because we want a high-end, high-quality data to be analyzed at the top end, but the data is to be collected by the people who are not that qualified. So that remains a challenge. Then misreporting, low level of accountability, no standardized format used for data collection. Hence, they are not interoperable. Duplication of data on multiple systems as many systems collect the information. Suppose I get services for immunization, but I get services for malaria or TB. But these two data sets, they don't talk to each other. So a lot of duplication are there. And added to that, a common identifier is required for the providers and the patient and the facilities so that we can link all this data. And lack of common IT platform is also one of the challenges. Which to address all these challenges, we thought that we should be having a common identifier as envisaged in the national health policy. When the Ayushman Bharat PMJ was rolled out, we developed a national health stack, which subsequently fed into the national digital blueprint. This national digital blueprint, which was agreed in 2019, gives an architectural framework for digital health in the country for evolution of national digital health ecosystem, and we are moving in that. So what this digital healthcare ecosystem will be addressing, it will address the issues of accessibility, it will address the issues of affordability, it will address the issues of quality. So what it will benefit? It will benefit the citizens about to discover health services and the providers, book health services, order health products, then avail video consultation. For the health providers, it will provide access and view patient history. It will provide digital consultation to the patient. For the policymaker, we can analyze and view the national health programs at the national and the international. So what we are doing currently to reach the vision of electronic health record of 1.3 billion. So what we are doing, we are trying to address all the issues and the challenges which we have focused in the previous slides. Creating a health ID based on Aadhaar or mobile number of the patient, voluntary services to be available by the citizens. Then we are trying to create a registry for the health workforce so that an unique identity is given to the provider. Health facility register is also created and ID is provided to the health facilities. Then all this thing would be fed into the electronic medical records so that it can be linkaged with that. And these electronic health records would be used for the subsequent, that is, surveillance and management of the program. Having said this, we do have some opportunities, and the trend is that the use of IoT devices, 5G is recently launched in the country. We are having blockchain technology which can at least address the issues of accessing the data. We do have telehealth, which can aid in remote ICU and patient management, web portal for patients, telemedicine, mobile health apps in this. Apart from that, increasing use of artificial intelligence we have seen during the COVID times. As we are moving in the right direction. With new technologies, we overcome the existing challenges and optimize the business processes. We need to adopt the rapidly changing digital world and use technology to improve efficiency. Identifying the problem and the opportunity and determine how technology, including technology, will solve the problem is critical. And the answer is how it won't. That's the answer lies. So always I say that we have to see that how we structure, whether we are addressing the problem or we are creating the problem for the practitioners. I will stop here. Thank you very much once again for this opportunity. Thank you very much.
Thank you so much. It was a pleasure to have you on the call.